Om Swastiastu. Hello everyone, today we're from SGD B8 will present you our student project with the title Echinococcus species. Next. So these are our team that made the student project together. Next. So the first material will be presented by my friend. Thank you.
Hello, my name is Felicia, and I will explain about the background of Echinococcus sp. So, Echinococcus sp is a chest toad parasite, a class of parasitic worms in the flatworm phylum or Platyhelminthes, recognized as a small tapeworm of carnivorous animals. It is triploblastic, and it has three layers, which are outermost ectoderm, middle mesoderm, and inner endoderm. Echinococcus sp does not have anus and digestive system. Its body is protected by tegumen and the worm is divided into a scolex, a short neck, and 3 to 6 proglottids with body shaped like a ribbon. Two most significant clinical forms of Echinococcus are cystic echinococcosis, caused by Echinococcus granulosus or sensulato, and alveolar echinococcosis, caused by Echinococcus multilocularis. Definitive hosts for Echinococcus sp, especially for Echinococcus granulosus, are dogs and the other animals in the Canidae family. However, humans can be infected by these parasites from the ingestion of contaminated embryonated eggs shed by stray dogs, which means echinococcosis is a zoonosis. In Indonesia, hydatid cyst caused by Echinococcus granulosus is very rare in humans, but has been identified in animals such as water buffalo, goats, sheep, pigs, and Tonkin macaque monkeys. That's all about the background. Next one will be delivered by my friend.
Hello everyone, my name is Gloria, and I will explain the objective of this study. So the first one is to define Echinococcus sp as parasitic worms. Second, to explain the transmission of Echinococcus species. The third one is to determine the presence of Echinococcus species on the body. The last one is to explain treatment options to Echinococcus sp. And the benefits are to improve and enhance understanding about Echinococcus species, including the risk factors, pathogenic effects, stages of diagnosis and treatment. The next one will be delivered by my friend.
Hello everyone, my name is Rizky. I will explain the life cycle of cystic echinococcosis. So the first one is adult Echinococcus granulosus sensulato will reside in the small intestine of the definitive host, and the eggs will be released by gravid proglottids and that are fast in the feces and are immediately infectious. And then after ingestion by a suitable intermediate host, eggs will hatch in the small intestine and release 6 hooks on cosper that penetrate the intestinal wall and migrate through the circulatory system into various organs, especially liver and lungs. In this organ, the oncosphere will develop into a thick walled hydatid cyst that enlarge gradually, producing protocysts and adductor cysts that fill the cyst interior. The definitive host become infected by ingesting the cyst-containing organ of the infected intermediate host. After ingestion, the protocysts will evaginate and attach to the intestinal mucosa and develop into adult stage in 32 to 80 days. Next. Next. Okay. And the next one is the life cycle of alveolar echinococcosis. The first step is this caused by Echinococcus multilocularis and have a similar life cycle like cystic echinococcosis, but the difference is in the step 4 shown in the diagram, the oncosphere will develop into multi-chamber or multilocular thin-walled alveolar hydatid cyst that proliferate by successive outward budding and it infects liver only. The next one will be delivered by my friend.
Hello, my name is Diela. I will explain about epidemiology and risk factors. First is cystic echinococcus or CE. Cystic echinococcus or CE is caused by Echinococcus granulosis sensulato larval stage infection. CE can be found in Africa, Europe, Asia, the Center, East, Central, and South America, and in uncommon cases, North America. The mode of transmission to people is by the coincidental utilization of soil, water, or food. Within the endemic zone, frequency rates of CE in people can pass 50 per 100,000 person per year, and the prevalence levels are as high as 5 until 10%, which happens in parts of Argentina, Central Asia, China, East Africa, and Peru. Next will be explained by my friend.
Hello, my name is Stefanus Christian Surya. Now I will explain alveolar echinococcosis epidemiology. Alveolar echinococcosis is caused by infection with the larval stage of Echinococcus multilocularis. AE is found across the globe and is especially prevalent in the northern latitude of Europe, Asia, and North America. There are approximately 18,235 alveolar echinococcosis cases globally. Specifically, about 16,929 cases occur in China and 1,606 cases occur outside China. The adult tapeworm is normally found in foxes, coyotes, and dogs. Infection with the larval stage is transmitted to people through ingestion of food or water contaminated with tapeworm eggs. Thank you. And next.
Hello, my name is Evia Sianto. So the pathogenic effect of Echinococcus sp itself is variatic depending on the type of species that infect the person. Like what has been explained by my friend, that there is a species of Echinococcus that causes cystic echinococcosis. This worm is a parasitic worm that we used to call as sensulato. This species is the type that is most commonly found. And another instance, Echinococcus multicularis, is a parasitic worm that evokes alveolar echinococcosis. In the last few years, this disease has been decreasing and becoming one of the most often matters. That's all for me. Thank you.
Hello, I'm Jonathan. Now I'm going to explain the symptoms. The first one is cystic echinococcus. This is commonly found in the liver and lungs. Abdominal pain, nausea, and vomiting are usually seen when hydathids are found in the liver. If the lung is impacted, the symptoms include chronic coughing, chest pain, and shortness of breath. Other symptoms depend on the location of hydatid cysts and the pressure on the surrounding tissues. Meanwhile, for the non-specific symptoms include anorexia, weight loss, and fatigue. And the next one is alveolar echinococcus. Alveolar echinococcus is categorized by an asymptomatic incubation period of 5 until 15 years, as well as the gradual growth of a primary tumoral-like lesion that is normally found in the liver. Alveolar echinococcus is progressive and lethal if left untreated. The symptoms include weight loss, stomach pain, general malaise, and evidence of hepatic failure. Next will be explained by my friends. Thank you.
Hello everyone, my name is Jonadia. I will explain the diagnosis of Echinococcus species. The first one is the one-step multiplex CPR that is very specific to identify this Echinococcus. And the step-by-step method are first, sample the collection, the DNA extraction, pre-sequencing, primary design and selection, multiplex PCR, detection capability of single and mixed infection, evaluation of specificity, and assessment of sensitivity. This method allows accurate, rapid, and simultaneous detection of different species of Echinococcus. It also shows a fast detection and large-scale screening that makes the best reason on why we should use this method to diagnose Echinococcus. But there is also other method to diagnose Echinococcus that is called ultrasonography imaging. It is a technique that is able to diagnose both alveolar Echinococcus and cystic Echinococcus. This technique also complemented by CT scan and or MRI scan. So that's all from me. Next will be delivered by my friend.
My name is Sophie, and now I'm going to explain about the treatment of echinococcosis. There are 4 treatment options that people with cystic echinococcosis can take. Those are percutaneous treatment for the hydatid cyst with the PAIR, which is puncture, aspiration, injection, re-aspiration technique, surgery, anti-infective drug treatment, and watch and wait. As for the treatment of alveolar echinococcosis, there is radical surgery, which is usually followed by anti-infective prophylaxis with albendazole. That's all from me. Next will be delivered by my friend. Thank you.
Okay, thank you, Sophie. Hello, everyone. My name is Janinta, and now I will tell you how to prevent cystic echinococcosis infection. The main prevention that could be done is to avert any transmission of the parasite. Actions including limiting the area where dogs are permitted, hinder animals from consuming cyst-infected meat, maintain the population of stray dogs, confine home butcher of sheep and other animals, try not to devour any food or water that may have been tainted by fecal issues from dogs, wash your hands with soap and warm water subsequent to taking care of dog and prior to taking care of food, and teach youngsters the significance of washing hands to forestall disease are the things that you could done to prevent any cystic echinococcosis infection. And for the alveolar echinococcosis infection will be delivered by my friend. Thank you.
Hello, my name is Cassandra, and now we'll move on to the prevention of alveolar echinococcosis. The first step is this parasite can be forestalled by keeping away from either direct or indirect contact with wild creatures such as foxes, coyotes, and dogs, also their fecal matter. The second step is to limit the interaction between dogs and rodent populations that can be done through keeping distance with stray dogs. The third step is to pat a dog that has been checked up medically. So the next explanation will be done by my friend. Thank you.
Okay, my name is Naomi Margaret, and I'm going to explain about the prognosis. The healing process of disease caused by echinococcus tends to be expensive. Both cystic echinococcosis and alveolar echinococcosis are often complicated to treat and sometimes requiring extensive surgery or prolonged drug therapy. Most cases of cystic echinococcosis remain asymptomatic until the cysts reach an outsized enough size to cause dysfunction. This disease will cause several signs and symptoms like hepatic enlargement. For some patients, chemotherapy with benzimidazole is a preferred treatment. Patients with small cysts or multiple cysts in several organs are often treated successfully with albendazole. Effective treatment involves benzimidazole administered continuously for a minimum of 2 years and patient monitoring for 10 years or more since recurrence is feasible. Furthermore, intermittent treatment with albendazole is not recommended. The next slide will be explained by my friend. Thank you.
My name is Pandey. For the conclusion of our student project, Echinococcus is a parasitic worm that belongs to the cystode class. This parasite can cause several zoonosis diseases for humans, which originally came from some animals in the Canidae family. The transmission of this parasite usually happens when humans ingest the cyst-containing organs, accidental consumption of the larva stage of the parasite, and also can be transmitted through close contact with infected animals. Echinococcus infection can be determined by looking at the symptoms that appear, because it can differ according to the organ that is infected. Laboratory testing for Echinococcus usually done through a multiplex PCR examination. The infection of this parasite usually difficult to treat and sometimes require extensive surgery or prolonged drug therapy.
So here's our reference for today's student project. Next. So that's all from our presentation. Thank you for your attention. Om Santi 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 Om.